Hello everyone, I'm Dr. Upashi Kashyap. I'm a MBBS graduate. I feel very much grateful to be a part of Prebuuk. So today here I'll be discussing a few points about how to keep our kidneys healthy. As we all know, kidneys plays a very important role in excretion, that is a removal of the toxic products from our body. So let us know how can we keep the kidneys healthy. First of all, the first points is that should come in our mind is hydration. Hydration plays a very important role because the more if the body is in a dehydrated state, that is less water, the kidneys are put into more stress, which may lead to further damage. We should have a good amount of water intake every day. Secondly, while doing exercise, it is very much important to not cross the limit, because once exercise is done, there is sweating and many changes takes place, which we should keep in mind while doing it. Thirdly, the food habits. In Indian context, it is seen that the salt consumption is very high, not only in the main course meal, but in other forms like pickle, like chips and snacks. Because salt in any forms, say rock salt, mountain salt or sea salt, the amount of sodium chloride is always high. So it is very much important to keep our salt intake in check. After that, we should know how is our blood pressure, because blood pressure has a direct impact on our kidneys. We must keep our blood pressure in we must try to keep the blood pressure in normal range. After that, how is our sugar status? Is the patient diabetic? Because it has been seen kidney diseases or similarly liver diseases, after say 50% the disease has occurred, after, or say 75%, after that we start to get the symptoms. So it is very much important to keep an eye from beforehand, so that the further damage is avoided. It has been seen having high blood pressure, high sugar in the body has affected the major organs in the body, like the kidneys, the heart. So it is very much important to keep them in check. We also have to see, is there any family history of high blood pressure or any events of kidney diseases in the family. Also, we have to ask the person what is his lifestyle, or in what type of occupation he is working. Say if the occupation demands a lot of stress or lack of physical activities, we have to keep all this in mind. So now, the next question is, how can we say that patient is having or is prone to disease? What can be the symptoms? Firstly, as I already mentioned, that kidney disease symptoms appear late. But then also there are some symptoms which we should keep in mind, like if there is swelling in the lower limbs, that is both the legs when we wake up, or if there is any swelling in the face, then if there is difficulty in micturition, that is if there is any difficulty while urinating, if there is any pain or say infection kind of thing, itching or pain while urinating. That if there is any kind of loin pain. What is loin? That is if there is any back pain near the kidney area. These are the points we have to keep in mind. In India, it is very common to see patients taking medications over the counter, that is without consulting the doctor. If the patient got hurt and he is suffering from pain, he directly goes to the pharmacy and take medication, which is because we all know kidney plays an important role in excretion, in metabolism of the drugs, of the medications which we intake. So it is very much necessary to know whether that amount of drugs he is taking is good for his health or not. So without judiciously, if you consume any kind of drugs or say over more than the specific period, any kind of painkiller medication which is taken for more than a prescribed period, and it is directly going to affect your kidneys. Now the third and most important part is, how can we prevent ourselves, or how can we diagnose early? Number one, it is very much important to keep a very good and healthy lifestyle, which we term nowadays as lifestyle modification. You have to modify, you have to make your previous so-called unhealthy lifestyle into a healthy lifestyle. Like you have to reduce your salt intake, say in terms of food, main course or whatever snacks. Reduce the intake of achar, pickle, chips, because this kind of packaged food have unhealthy salt content more. Secondly, you have to consume very good healthy homemade food, not the outside food. physical activity is very much important. Daily physical activity, be it running, be it walking, any kind of body movements is very much important. Then we have to reduce if a person is habituated to smoking, he has to reduce it, because cigarette smoking is one of the factors which impacts the whole body. Because the side effects of smoking has been seen in all parts of the body, and it directly involves the kidneys also. So it is very much important to reduce or stop smoking. Then alcohol consumption, you have to reduce alcohol. If anyone is habituated to alcohol consumption, the person is asked to reduce it. After that, no judicious use of medications. Stop over-the-counter medication without consulting your doctor. Regular blood pressure monitoring. Every month you have to do twice. And if there is a positive family history, then you have to be more conscious and cautious about it. Kidney function test. And you have to be very much aware of your symptoms. If you see any changes while your daily activities, you are to visit your doctor, or you have to consult your doctor. Say you are having difficulty in micturition, urination, or say you are having any kind of pain, on loin pain, that is on the backside you are having pain, or you are seeing swelling in the legs, you are to take immediate action so that further damage is avoided. And lastly, try to live a stress-free life and stay happy, take less tension, eat good food, be physically active, and eat healthy food. Thank you. Have a great and healthy life ahead.